Australia is a multicultural society. It is a country of Aboriginal people, migrants, and their descendants. There is cultural diversity across local health districts in New South Wales. There is also cultural diversity within local health districts. 5 in 10 people in Western Sydney speak a language other than English at home. People from culturally and linguistically diverse backgrounds include first, second, and third generation migrants. Different generations may have different needs. Providing equitable health care is more than providing equal access to services. Vulnerable individuals or communities may require assistance to achieve the same health outcomes as others. New South Wales Health identifies people from culturally and linguistically diverse backgrounds as a vulnerable group because compared with the general population, they are more likely to experience poorer health outcomes, increased adverse events, less satisfaction with care, increased length of stay, increased avoidable admissions, increased readmissions. In order to provide quality care, we need to know who our patients are. We need to ask every patient 3 questions. What is your country of birth? What is your preferred language? Do you need an interpreter? This allows us to better understand the needs of each individual. Providing quality care includes meeting the patient's language needs by providing face-to-face interpreters, telephone interpreters, and/or translated written health information, assessing the patient's knowledge and understanding of the health system, and providing health information in a way that is accessible, responding to the patient's health beliefs and understanding of their illness. By taking the time to understand the person's perspective, taking into consideration the patient's use of traditional or alternative medicines, and negotiating mutually acceptable treatment plans, attending to the patient's need for family or extended family involvement in decision-making. By including others in decision-making as requested, fairness doesn't mean giving everyone the same thing. It means giving every person what they need. Equitable health care includes planning for the whole population, not just those who have easy access to the health system. To understand the needs of our communities, we need to ask, who are the communities in our area? Where do they live? How old are they? When did they arrive in Australia? What health issues impact disproportionately on these communities? What do we already know about these communities, their health, and their use of health services? Are our services being accessed by all members of our community? What do community leaders and community groups see as the major issues for their community? Addressing these needs involves reducing barriers to accessing health care, creating welcoming environments, supporting a diverse workforce, offering services and programs tailored to community needs, developing targeted and flexible models of care for vulnerable communities. By understanding the needs of our diverse communities and designing our services to meet their needs, we can achieve fairness and a truly inclusive and responsive health service.